Companies' global health footprint. Could rating help? Business decisions have a huge impact on public health. Companies boost global health when they produce medications for diseases that have terrible consequences worldwide or donate to cost-effective health charities. Conversely, the health of populations suffers when companies pollute, produce unhealthy food, hide the truth about drug efficacy, block the production of generic medications, and lobby against important safety regulations. Some companies and their executives and shareholders already facilitate global health. Many more would do so if that decision positively impacted not only the health of populations, but also their bottom line. One way to help: global health footprint labels that rate a company's overall impact on human health. This system would rigorously and independently assess companies' overall impact on human health, including the health of the world's poorest and sickest people. Its ratings would single out companies for promoting global health and for reducing or eliminating practices that harm it. This information would be communicated to the rest of us in user-friendly ways that invite action. High points would go to companies like a Chinese toy producer that meets International Labor Organization workplace recommendations on safe noise levels, a Namibian-German beer producer that annually funds training for a critical mass of clinical officers and anesthetists to conduct safe C-sections in Namibia, a Swiss pharmaceutical company that does not lobby for harmful patent protections in developing countries. Global health footprint labels would inform the public and enhance choice for ethically minded corporate board members, investors, business partners, workers, consumers, and regulators. Companies would stand to gain more from improving their global health footprint. They could ward off negative consequences like consumer boycotts, investor activism, and hostile regulation. Public financing and charitable donations have their limits. Budging even a fraction of the vast resources of the global for-profit sector could transform global health. More and more consumers and investors care enough about global health to promote it. Sales of fair trade certified products grew a whopping 75% in 2011. Without global health footprint labels to identify those companies that are doing their part to promote global health, ethical investors, consumers, and regulators cannot tell which companies to reward and which to penalize. For example, they don't know which companies' products to buy. It's surprising how often political parties locked into disagreement on social, economic, and environmental issues agree on the importance of global health. In America, Republicans and Democrats alike help fund the fight against HIV/AIDS. This consensus makes global health an especially promising area for progress through social feedback on company practices. Global health footprint labels would close that feedback loop. They would strengthen companies' incentives to keep humanity healthy. Want to learn more or take action? Visit peh.harvard.edu/events/2013/global_health_footprint. Rating companies' global health footprint. This clip was funded by the Harvard Global Health Institute.